So I'm going to go through on how to achieve full marks on your dermatology specialist training interview. Hi, my name is Dr.ErmaDerma and I'm a dermatology resident doctor. I actually got into dermatology training in the most competitive round, and I also help other junior doctors to get into dermatology training by helping them with their portfolio and interview practice. So let's get into this. It's really important to know the structure or the format of the interview. One website that I do recommend you to go on is the PHST recruitment website, because it has all the up-to-date details on your dermatology specialty training interview. If we go on this website, you can see that there are 3 stations for your dermatology interview. The first one is the research and academic station, second, clinical station, and third, suitability and commitment. In total, the dermatology interview would last for 30 minutes. For the research and academic station, you'll have 5 minutes to read an abstract and critically appraise this and make your own notes. In the 7 minutes, you'd have to relay back on what was read on that abstract and also your own critical appraisal. The interviewers will ask you a few research questions as well. For the clinical scenario, they'll give you a dermatology clinical scenario. You would need to answer questions on how you will manage this patient and how you will communicate that condition to the patient. And the third station is the suitability and commitment station. So these are questions like, why did you pick dermatology? And they give you opportunity to expand on what was written on your dermatology application form to apply for the dermatology specialty training. This will also last for 7 minutes in that station. Of course, it doesn't mean that all of these stations have a particular order. You can randomly be placed into starting with the abstract station first, or the clinical scenario, or commitment to speciality. And then once you've done your interview, you'll actually get scored by the interviewers on how well you've done on your interview. So 1 is poor, and 5 is excellent. So ideally, you would want to score 5 on all of your interview stations. Then you'll have a total score on how you did on all of the stations, and you'll have a score at the end, which is out of 100. Now, the majority of your points come on how you did on your interview, and less so on your portfolio to actually achieve the dermatology national training number. The dermatology interview is marked very heavily, and it's really important to prepare as well as possible for the dermatology interview. So here are my tips and tricks to get full marks for your interview. So let's begin with commitment to speciality. What I do advise is to prepare your answers as early as possible for this. If you are a natural talker and you feel that you can wing the answers, that's great for you. But unfortunately, I wasn't one of those smooth talkers, so I had to prepare my answers for each and every possible questions that could have came up. So one book that I do recommend is the Medical Interviews book. And I went through each and every question and literally wrote down the answer and learnt that answer off by heart, because you don't want to come to the interview and you have to think of a scenario, or you have to regain your memory on what you did for your quality improvement project or what skills you gained from that placement. So at least it's there already written, and all you have to do is just literally say it off by heart. When you are preparing your answers, make sure you keep your answers between 1.5 to 2 minutes. You don't want to waffle, and you also don't want to have a very long introduction. You just want to answer the question directly and efficiently. The worst case scenario is that the interviewer will lose interest and stop listening to your answer. And in terms of writing your answers, I'm sure all of you have achieved such great things, but it's actually not about what you say, but on how you structure your answers. So in terms of structuring your answers, I would keep your points at least 3 to 4 points and expand on each one. There were some structures that I used to help answer my scenarios. One of them was the camp structure. Now, the camp structure is really great for background and motivation questions, such as take me through your portfolio or why dermatology. So the camp structure is C for clinical, A for academic, M for management, and P for personal. For any skills-based questions, I use the STAR acronym. For example, give me an example on where you led a team, give me an example where you managed a team, or questions along those lines. So the STAR acronym is where stands for situation, T, task, A is for action, and R is for result. And if there were any questions on dealing with difficult colleagues or patients, I used the SPIES structure. So the SPIES acronym stands for initiative, E is for escalation, and then the last S is for support. So make sure when you do write down your answers to have a structure, and you can say this succinctly and efficiently, to the interviewers. And if you ever have any questions that are negative, such as what was your least favorite specialty, make sure you always put a positive spin at the end of your answer. For example, one of my questions was, what was your least favorite rotation? I tried to say at the end of my rotation, which I least enjoyed, I learned so much by time management, by escalation, and distributing my work. But of course, it all comes with practice. Once you've prepared all your answers, you'll get the gist of how to answer these type of questions. For the clinical interview station, they are going to ask you on conditions that you should know during your MRCP or during medical school. What I would advise is to actually get your MRCP book out and go through the dermatology section and just read all the cases and conditions there, as well as going through the British Association of Dermatology handbook for medical students as well as for junior doctors, and read all the conditions in there. And for every condition, make sure you write down your own set of notes on how you're going to describe this condition and how you're going to manage these conditions, and also how you're going to communicate that to the patient. Because the interviewers are going to ask you how you're going to communicate this condition or your management plan towards the patient medical jargon, and to keep that portion of the answer as simple as possible. And of course, have a structure for the clinical scenarios. And they ask you to manage this patient, make sure you go through the presenting complaint, the history of the presenting complaint, past medical history, any over-the-counter medication, review of systems, examination, investigation, and your management. So sometimes they'll ask you about therapeutics. For example, this patient has received a side effect from a particular medication. How will you treat this patient? So it's important to go through your systemic medications such as cyclosporin, methotrexate, and all the side effects of this. Again, write this down if you need to, make notes and learn it off by heart. The other important point to mention is that they want to see if you'll be a safe registrar. That means getting your consultants or your seniors early in your answers, especially if the patient is very sick, and if you need to get multidisciplinary team members to review this patient as well. Okay, so the last station is the abstract station, and I know a lot of candidates are very scared about this station, but it's really important to prepare early and to practice as much as possible. What they will do in the interview is they'll show you an abstract for 5 minutes, and they'll take that abstract away, and you have to say everything off by heart, including your critical appraisal. So what I would advise to do for the station is to go through PubMed, BJD, or CED, and go through every single abstract for research, such as randomized control trials, cohort studies, case control studies, and to practice your critical appraisal. If you are new to critical appraisal, then I would advise to go through the CASP UK website and go through their courses and download their checklist and go through each abstract using that checklist. One structure that I would recommend in actually saying your critical appraisal is the PICO method. PICO is an acronym for P for population, I for intervention, C for control, and O for outcome. And they're going to ask you 1 or 2 questions about research terminology. Make sure you learn all the definitions of research off by heart, such as all the different types of bias and confounding factors. So once you're done with your interview, try to write down all the questions that you had, because hopefully not, if you have to go through the interview again, at least you know what was asked beforehand and how you can improve on this. If you ever need any interview help, I offer one-to-one interview coaching. And if you need more help about the abstract station, I actually done a separate video for this.